Welcome tonight. So, tonight we have the opportunity of having two lovely women from Zero who are here to talk about a couple programs that they have available for prostate cancer survivors. What's interesting is Zero is a national organization that's actually based here in Alexandria, Virginia. So we're very fortunate that they're right in our backyards, and I've been kind of blessed to be involved with them, and just this week I went and we filmed like a couple segments about prostate cancer and stats about the beard and all these different things. So it's been a great way that they've been able to help me get the message out to try and impact a lot of people. So it's very nice that we have them in our backyard, and that's why I brought them here, because I want them to be able to talk to you about how they can possibly help you in different areas. And one of the key things we talked about before was how to give back, also kind of make a difference. And they can talk about different charitable ways that we're trying to raise money and funds for research, but also get that awareness out. And so this is just kind of a slide I put up that talks a little bit about like what Zero is, but they do a lot with patient programs. They do a lot with advocacy and research on Capitol Hill. They're very strong there to kind of help guide these legislative bills. We had talked before about the concern about PSA screening, and they were very strong on the Hill in terms of advocating for PSA testing. So, these are ways that we can help to give back, and they're always looking for, spokespeople like you who can share your stories and kind of, whether it's on the Hill or in newsletters or anything that can help impact other men as we kind of move forward. So I'll let them talk a little more about that. But one of the key things, and I had mentioned this before also, was we do the big Zero prostate cancer walk and run every Father's Day over in Arlington. So it's just another great way to get involved. And just last year, we were second in the country in terms of fundraising, raised about $180,000. So these are all these other ways that you can get your family, friends more involved in this as we move forward, trying to raise awareness to the level of breast cancer where you see it, people talk about it. We really want to kind of get that message out. So without further ado, I'm going to introduce, we've got Shawn Supers here, and we've got Ahmed. They're going to talk about two different aspects that are involved in the Zero program. And they've been handing out different Zero flyers and bracelets, things like that. I'm going to hand it over to Shawn so she can talk a little bit about the Grow and Give campaign, why we're growing our beards out, and why you'll see she's sporting this lovely mustache, okay? So I'll introduce her and let her take over.
Thanks, Dr. Gandhi. Hi, everybody. As Dr. Gandhi said, I'm Shawn Supers. I am the Mid-Atlantic Chapter Director with Zero, so I'm thrilled to be here this evening. I'm curious, how many of you all knew we existed before you got here this evening? One, maybe a couple of you. Okay, David, you knew. All right, that's good to hear. Well, I'm super excited then to introduce the rest of you to what we do at Zero. Quite simply, our mission is the end of prostate cancer, and I think everybody in the room can get behind that as a mission. Yes? All right, very good. So, Dr. Gandhi, he was saying earlier that he was blessed to be partners with us. He's really, I feel like we are blessed to be partners with him. He's very passionate. He has not said no to anything that we've asked him to do yet. And he's going to be a major partner along with all of the others there at Potomac Urology with us as we move forward and get closer and closer to the end of prostate cancer. So thank you for having us here, Dr. Gandhi. I really appreciate it. So I'm here with my blue mustache that is just to have a little bit of fun and make you guys smile a little bit, lighten up the mood here a bit as we talk a bit about one of the campaigns we have going on this month, which is Grow and Give. And it's a facial hair growing campaign, technically speaking, but it's really super easy. We don't have any rules per se, so you can do anything you want to. I'm looking around the room and I see there's a gentleman with a full beard. There's another one with a little scruff going, some peach fuzz. So some of y'all are already on your way. He's got a nice mustache over there. I like that stash. You want to have a competition? All right, yeah. So Grow and Give is a fun campaign that everybody can get involved in participating in. Even the ladies can get involved with this. You know, you can really make of it what you want to. We're here because 1 in 7 men are going to be diagnosed with prostate cancer in their lifetime. And Dr. Gandhi referred to the breast cancer movement a little while ago. I've also been an advocate for the breast cancer movement in my career, and what I find really interesting is that there's a higher incidence rate among men of prostate cancer than there are among women with breast cancer. So it's a really important cause that we get behind and that we get the community involved in. And like you said, start changing the way things are going down here in our community. I'd love to see in September the football players wearing blue shoes, just like they wear the pink shoes in October. Wouldn't that be cool? That's one of my personal missions, certainly. We're really proud at Zero to say that of every dollar that we raise with our fundraising programs, 94 cents goes directly to the programs. That's thanks in part to the partners that we have in the community, like Potomac Urology Practice, that help us keep our expenses really low by volunteering their time and energy to help us with things like the DC Run Walk that we've got coming up. So I know that's always a big question for folks when they're talking with charitable organizations, and I just like to brag about that right off of the top, that we have a really great track record where that's concerned. Dr. Gandhi talked a little bit about the DC Run Walk that we have coming up, and Father's Day weekend 2017 is the big weekend. And one of the things that's really fun about the DC Run Walk is that it's a great way for all of your friends and family to get involved, to rally behind you guys, the survivors and the patients, and walk out what might be a really frustrating situation that you don't have any control over. So it's really fun to put it out there, get the teams involved, get the teams going, and get your family and friends involved. And, you know, I've talked with some prostate cancer survivors myself, and first time that they participated in run walks, and they say, you know, it was really nice to have something positive to focus on while I was also battling the cancer. So it's a nice community project for everybody to get involved with. And Dr. Gandhi and I are building a committee right now of volunteers who are helping us with the race. If you have any interest at all in getting involved, please let him or I know, and we'll be happy to invite you to our committee meetings. We're planning on having a kickoff at our offices in Alexandria on December 8th. We're going to have a little kickoff party. So we certainly would love to have some survivors and patients represented on our committee to help us make sure we've got a really well-rounded perspective, and a lot of folks in the community helping us make the race great. I think I'd like to raise $250,000 or more with the race next year, because that means that we can fund and fuel the programs that are going to help you guys and your families, and that's what we're really all here about. One of the major things that we do invest in are our educational programs and our educational materials and videos. If you go to zerocancer.org, which is our website, you will find a whole source of great educational materials and information, and some educational videos that you'll want to check out. So the Grow and Give campaign, if y'all want to get involved with it, it's really pretty easy. I gave everybody a take-home card there. The website is zerocancer.org/grow. It's free to register and start a team. So there's nothing preventing you guys from getting up there and getting a team together. There's no fundraising goal per se, except for the one that you might set for yourself. You can have as much fun with it or as little fun as you might like to. There are some gentlemen who are shaving clean and starting at day 0 and kind of doing pictures every day. There's some who are doing videos like Dr. Gandhi here. We got him to do some fun stuff for us. And so I think it's a really easy way to get involved, and certainly you all have a vested interest in helping us put an end to this disease. So I hope you'll consider joining us. We do have some great tools available to help you with your Grow and Give campaign if you'd like. We've got a toolkit that's filled with stickers and business cards and the little plaque cards that people, when they donate to you, they can sign their name or their team name on it or their family name and have posted somewhere. So there's a couple of samples of the toolkits on the back table there. You're certainly welcome to take one, and if we run out of them, let me or Dr. Gandhi know, and we'll be sure to get you the tools that you need. social media is really your best friend when it comes to this kind of campaign, because you can share the fun pictures and the videos if you want to. This is a great picture of a team of first responders who are participating. I'm really happy to say that we've got a number of first responder teams around the area who are participating in this. Laurel, Maryland Police Department, Greenbelt, Maryland Police Department. I think the Arlington firefighters got on board recently, and we're working really hard on the Alexandria firefighters too, because we'd like to have everybody represented. If any of you all are connected to a business or a group of folks that you think might be interested in starting a team, we'd certainly love to have that. So keep those folks in mind and invite them to participate. And one of the easiest things to do is put a post out on Facebook, say, hey guys, I'm doing this campaign, who wants to get in with me? Go to zerocancer.org/grow and sign up right now. So we do have some awards for incentives for top fundraisers. We've got a lovely mustache keychain for anybody who raises $100 or more for the campaign. We have a nice Beard Up notebook and pen that goes together for folks who raise $250 or more. And anybody who raises $500 or more gets this really nice premium wall personal shaver kit, which they're a major sponsor of ours for this program. So some fun stuff to keep you kind of moving forward and getting excited and getting involved with the fundraising part. So if anybody has any questions for me now, I'm happy to take them. And if not, then you can jot down my email address and my phone number there, and certainly reach out to me at any time. You have a question for me? Yes.
No, I have a number of questions. Let me just throw them all at you. You can answer some of them or all of them.
Okay.
Where does the money go? Are you getting funds just from private people? Have you tried writing grants? Talk about the organization, the history, how long has it been around?
Mm-hmm.
Are you working with known cancer organizations, National Cancer Institute, for example, and Sloan Kettering and whatever?
Great questions.
Yeah, and again, where does the money go? Are you putting money into research? Is it a private thing? Are you coordinating with other research programs that are going on?
Yes. So I can answer a lot of those questions, and I'll probably refer to Ivy to help supplement some of the information about the research in particular. But I can tell you that the organization was founded 20 years ago in 1996. It was originally modeled off of the National Breast Cancer Coalition. So they kind of mimicked that in the creation of the Prostate Cancer Coalition. The name has changed, I think, a couple of times in the last 20 years. So we're now ZERO, the End of Prostate Cancer, which so clearly states what our mission is. So I kind of think that's nice. As I said earlier, 94 cents of every dollar we raise goes directly to our programs. So just to give you a comparison, the Better Business Bureau standard of giving for a charitable organization is that 65 cents of every dollar raised goes to programs. So having 94 cents of every dollar raised is really an exemplary statistic for us to be sharing, which is why I'm proud to share that with folks. We do invest in a number of different types of programs, from the Patient Navigator program that Ivy is here to speak with you all about this evening, which is something I think you'll all find very interesting and very compelling, to our educational materials. You can see a small sample of them on the back table there of the different materials that we provide. And I'd encourage you all to check out what's back there, because some of them are information sheets on advanced prostate cancer and what you should know, the questions you should be asking your doctor, or if you've just been newly diagnosed, what kinds of questions you should be asking and what kinds of things you should be doing for yourself. And just some really great materials, even to help you talk like with your family members and things like that. So there are definitely educational materials that we invest in, and there is a great deal of research also, but I'm going to refer to Ivy to share a little bit about the research. Ivy, do you mind if you share a little bit?
Yeah. So I'm Ivy Ahmed, and I do our patient services, and I'll talk about one of them in particular. But sort of two things to address on the research front. So we do have a research fund, and we have provided 2 substantial grants, one to UCSF to take a look at some new early detection models and some research that Peter Carroll is doing there. And then we've also provided some funds for a researcher in Tom Baer's lab at the Oregon Health Science University. So, and those are there's translational research at the moment, and so we're still We've done a couple of different rounds of grants on them to support, and they're supporting our grants are small compared to those large NIH, National Cancer Institute grants. So really what we, for us, we were in very much a position, as we set them up, we were very much in a position to be able to say, we can't cover your overhead costs. So we know that our money went directly to the actual research. So we're very pleased with that.
Yeah, go ahead, Dr. Gandhi.
And just as a clarification, and correct me if I'm wrong, but a lot of also with Zero, a lot of the kind of focus is with advocacy and kind of legislation versus like the Prostate Cancer Foundation,
Sure.
where a lot of their focus is in kind of the research realm. So kind of working together to handle two different things.
Exactly. And that also speaks to his question about, do we partner with other organizations in the community? Absolutely, we do. We are not the end-all be-all when it comes to services, but we have some great relationships with other groups like the Prostate Cancer Foundation and the Patient Advocacy Network, who are partners with us. So we certainly do work with those guys. Advocacy is a huge part of what we also invest in. There's actually the Department of Defense has invested each year in their budget. They have set aside $80 million for prostate cancer research. That money is so critical for us to protect and hopefully grow their investment in, because it has actually produced, 2 or 3 treatments, Ivy?
Yes, so it's the Congressionally Directed Medical Research Program has the prostate cancer research program, and 3 of the recent treatments in the past 5 to 6 years have come out of it. Research funding was provided in the development of enzalutamide and abiraterone, as well as, I believe, Xgeva.
Okay.
So
we certainly do work with other organizations, and we part of our advocacy team is working to protect those funds and to convince folks to invest even more in it, because it has proven great results for prostate cancer patients and survivors.
I want to hop in about another collaboration. And so you asked specifically if we work with National Cancer Institute and things like that. So we do actually have some great relationships with some of the researchers that are in there. And one of our advocacy initiatives, our legislative advocacy initiatives, is to get the researchers, the prostate cancer researchers at the National Cancer Institute, of which there are at least 8 to 10 different departments of them, talking to the people in the prostate cancer research program of the Department of Defense and talking with the people at CDC. And right now, those groups independently aren't working together, but we as an organization have actually been able to make some headway and are working towards being able to bring those groups together. So being able to work on collaboration so that they're operating in less of a silo, and then ultimately it's going to be better for the patient community because we can get those treatments out faster and have a greater impact.
Awesome. Thank you for sharing that, Ivy. And then I think the last question that I didn't address yet is, where does the funding come from for Zero? So, yeah, well, it actually comes from a number of different resources. We do have a lot of corporate support from pharmaceutical companies who have a vested interest in what we're doing. They support a lot of our programs, the Run Walk program, Grow and Give, and so forth. Certainly corporations who are invested in the local community, they also contribute. We do write grants. Dr. Gandhi and I are working on all kinds of businesses to get sponsorships for the upcoming race. And then we also do, of course, rely on the personal donations of our peers, if you will, through fundraising campaigns like Grow and Give or like the Zero Run Walk program. So there are a number of resources that we turn to for support. And they all add up and help us get to where we're going. I always like to say that my job as a fundraiser is to fuel our programs. You all know, if you don't have gas in the tank, you're not going to go anywhere, right? So it's really important for us, even though folks don't often like to talk about fundraising and the need for it, it's actually really critical to us to be able to deliver the programs and the services that we do to our families. We have to have funds in order to make that happen. So I really appreciate you all listening here. Did you have one more question?
10% overhead is pretty impressive. I assume that you've got paid staff, you're paying for an office, that kind of stuff.
Yes, yep, we have a small office there on King Street in Alexandria. But we all work really hard. I think we're all very dedicated to the families that we serve, and that's always foremost in our minds. And so we're always very mindful of our expenses and keeping our expenses very low, and hopefully our productivity and our revenue really high. So thank you. Anybody else have a question for me before I turn it over to Ivy to talk about our Patient Navigator program? Yes, sir.
Does it not bother you that nobody's heard of you?
Does it not bother me that nobody's heard of us? You know, part of me is troubled by that, I guess. You know, I was a little surprised when Zero first recruited me to join their team, that there wasn't more traction with prostate cancer. There was a little bit of a head scratcher, but I think there are some pretty legitimate reasons behind it. One, you all here in the room, I think, are the outliers to the commonness that most men don't want to talk about healthcare stuff, right? So getting men to talk about their journeys and maybe their past diagnoses and being a survivor, maybe not as easy for gentlemen as it is for women. You know, we talk things out, we talk our stress out. Men deal with it, I think, in a little bit different fashion. I think also that the prostate cancer Coalition, as I said, was the first name of the organization when it first started 20 years ago. Just about 10, 15 years behind the breast cancer movement. The Komen Foundation was founded in 1986 or 89. I don't recall right off the top of my head, but we're about, I think, 10 years a little bit behind them. So we've got a good mission ahead of us to turn that conversation around, and you all can be really helpful in that by being willing to share your story, by volunteering with Zero, by helping out when and where you can. And if that's not your level, and what you do is you talk to your best buddy about what his PSA level is, or if he's talked to his doctor about what his risks are, that is just as valuable. But I think the key for us here is getting the word out and really embracing your role as survivors and celebrating that. Because then we'll get more men to talk about it. And ladies, we know, right? It's sometimes tough to do that. I'm happy to see you all here because we can also be an influence in talking with our fathers and our husbands and our sons about this cause and the importance of knowing their numbers and really, you know, light that fire under them to do what they need to do for the sake of the family. Yes, sir.
Zara, what's the functional difference between your organization and us2.org?
So as I know, as far as I know, us2 is strictly about support groups. Isn't that correct? Oh, okay, Ivy's going to take that one for me. She knows the us2 people. I'm fairly new to Zero, so she's going to take that one for me.
Yeah, so we work very closely with the headquarters office in us2 in Chicago. And we at Zero don't do any support groups, and that's really the goal of us2 is to provide information, education, but also really getting on into the community and having that presence for the support groups. And so we as an organization provide a lot of support opportunities and resources, but we don't do support groups. Very specifically, we don't do them, and I always say because us2 already has the market cornered on that, and there's no reason for us to recreate that. So, I mean, they do have it. They have their own educational materials, they have education programs, they have their own fundraiser. So we all advocacy groups have to have that other additional presence, but they really very much own the space of the patient-led support groups. Mm-hmm. And so
that's a great example of yet another community partnership. And as she said, Zero is trying to use our resources wisely and solve problems where there's a need. And so if us2 is already doing the support groups, we don't necessarily need to invest in that. We'll partner with them and help share the good word about what they're doing. All right. Any other questions? All right. I hope you all will take a look at the materials that I gave you. Again, I'm Shawn. I love to chat with people about things like this. So if there's anything I can do now or in the future to help you, please feel free to reach out to me. Or Dr. Gandhi is my partner in crime as well. Thanks for having me up here. And I'm going to turn it over to Ivy now to chat about our Patient Navigator program.
Well, thank you, Shawn, for the fancy, and with your fancy blue mustache. I don't have one.
I think it's about to come off permanently. There we go.
Yes, not a bad thing. So,
I did, just
yes.
like that.
No Shave November. Yes. So I just want to introduce myself a little bit so you have some context of what I do at Zero. I do all of our patient support programs, and I've been with Zero for 3 years, and I've had a firsthand opportunity to really watch this organization grow from a very small group to having a presence to now we have chapters. I mean, Shawn is new. I mean, when I came on board, we have strong partnerships with some urology practices, but now we actually have a community presence on the ground, and it is such an honor to be able to watch this movement grow and really be a part of it. And I actually started just doing our patient education, and my background's in public health, and then we've been able to add additional programs. We had a copay assistance program where we were able to provide money for treatment for men who needed those services, and we now added this patient Navigator program. And so it's really very much an honor, and it's an honor to be here. And my passion is about making sure that people have access to the right information, because I really do believe that if you don't have the right information, you're going to have a bad experience at the doctor. You're not going to understand what's going on. And a lot of times people, and everybody I know, from doctors, not necessarily this one, but from doctors to your average person, you get in the room with your physician, and there's always something you forget. There's something you meant to ask and then you didn't. And it's just practice in human nature. But it's my job to help people, one, sort of be able to calm down and relax about that, but then also be able to have some information they can take with them, or notes that they can read. And they don't have to take my document to the doctor with them, but I'm happy knowing that, oh wait, I read that somewhere and I knew to ask that question. And so that's really what drives me in terms of being able to do that. And so I want to go back to your question about more people not knowing about Zero. And it does bother me, because to me that means they're not getting access to our materials. And so I'm super excited that we're here have this great partnership now with Dr. Gandhi, and then sort of with the Nova, and we have Shawn here who really can be pound the pavement and make sure more people know about us. So I'll get off my horse and tell you about a new program that we just started. And so we know, and we hear on a regular basis from men who are living with prostate cancer, that they experience barriers to care. And really what a barrier to care is: financial, economic, anything that impedes them from getting the health care that they need. And we're really not talking only about men who are in active treatment, but if you're having long-term side effects, and that every 3 to 6 months for follow-up, but are you able to have that? Do you understand what happens? For men who English isn't a first language, are they comfortable and able to communicate with their physician? And then even beyond that piece, is the healthcare system, is their access to healthcare working in such a way that they know where to go and what to do? I will routinely talk to guys who say, I'm not really sure if I go back to my urologist. I've had surgery, 2 years ago, but do I go back to my urologist? And my response to that is, you need to call the urologist and find out what the follow-up post-treatment care plan is. But again, it's really being able to, and help them figure out, where do they go and what do they do? And so these are really, what we call, barriers to care. And so we hear about these things, and we started trying to understand, what can we as an organization do? I mean, now I have a very small department, and definitely, as we can't do this. We can't do this hand-holding, and we want to be able to provide this service. And so we looked around and took an opportunity to see, let's build a program. Let's be thoughtful about it. Let's use a good, solid approach and figure out what works, what's working elsewhere, and how can we do that. So we actually did a needs assessment with a survey. We interviewed men who'd been diagnosed with prostate cancer, as well as loved ones. And then we also took it one step further and interviewed providers with our survey. So there was a companion survey as well. And not just urologists, medical oncologists, and radiation oncologists, because we wanted to understand from the clinician side what they perceived as priorities for their patients. Was it needing information? Was it financial assistance? And a lot of the feedback that we got from the clinician side was, and I remember reading some of the quotes where one of the docs said, I'm embarrassed that I don't know with my patients what these other priorities are. Not the clinical side, but how do they manage all of these other pieces? And so for us, it just, even more fuel to be able to say, here we are, and our job as advocacy is not to heap more work on the doctor. Our job as an advocacy organization is to go hand in hand and say, here's how we can help you. We're your handoff. This is where we make you able to do and leverage your expert skills. And so we looked around and said, who has successful navigation programs? Who's able to provide these services all across the board? And we identified a partner, a patient support organization called Patient Advocate Foundation, and they're located in Newport News. And they originally began with a case management model where they have case managers who help people identify. Again, it really grew out of a need for financial navigation and support. And they've really branched out. And so we now have a special program for ourselves. And then we started developing a program. We've been doing it. We launched last week and hope to grow it and build it. And I want to thank Potomac Urology and Dr. Gandhi, because you are our partner, our first partner on this, and a lot of support and the opportunity to be able to share it is great. And so we moved on with the program. And pretty simply, the goal of the program, it's called the Zero Prostate Cancer Care Line. And the goal ultimately is that one in the middle, and it's to save lives. And we can do that by helping patients and their loved ones get through the healthcare system so that they don't have to spend their time stressing about, which insurance, which bill do I open, which do I not, how long do you play the waiting game before your insurance kicks in to see exactly how much, that they can get to the doctor on time and really focus their efforts on being able to fight disease. And that ultimately we do these things, we eliminate barriers, and ultimately we improve health outcomes. So there are three major things that we cover in the care line. There are a lot more, and you'll see some really painful slides, I'm sorry, that come after this, lots of words on them. But I just want to kind of talk very generally, about sort of three buckets of support that the patient navigation program provides. And if there's something that I don't hit that you want specifically to know about, feel free to ask. And if it hasn't been mentioned in sort of all of our work with them, I can find out for sure. But really, understanding patients' insurance, what's their employment status, and what are their access to care needs. And then being able to provide some resources and support for emotional health, as well as patient education information, local resources in the community, and then also helping patients make some treatment decisions. Is it at a time where they're having a biochemical recurrence and wanting to decide what to do? Not giving them treatment advice, but helping them understand that there's information, getting them that, and then helping them get to their physician that can help with coordinating a second opinion, and also some of the clinical trials things that might be available for people. So I said this is kind of a wordy slide, but needless to say, in terms of the financial side of it, what our navigators can do is really help people identify financial assistance resources that are in the community. And there are many resources in the broader cancer community. At this point in time, unfortunately, there is no copay assistance for men with Medicare for prostate cancer. It's very distressing to us as an advocacy organization and disappointing. And so, we work very hard at trying to get that open and get those programs funded. But there are other things that people may not always think about. So you think about there's the copay for the physician, but there's insurance, and there people have co-insurance and deductibles, and all these different pieces that factor into the puzzle. And so being able to identify programs that might be accessible and appropriate. And we know as members of the healthcare community that managing the cost of cancer is exceptionally expensive and time consuming. But what we don't always acknowledge in that space is that the distress that it causes people, the actual toll that it takes on being able to be compliant with your meds. We don't want people splitting pills. That's not productive. So we want to make sure that patients feel comfortable having that conversation, saying to their doctor, I don't know that I can, pay this deductible. I don't know if I can make a copay every single time. And so we certainly, as an advocacy organization, always encourage people to have those conversations. And so being able to provide these resources, here's our great team that can talk to somebody about it and say, look, these are resources there, and here's a way to talk to your doctor about maybe you can negotiate for something. And so just really being mindful that, everybody struggles with the cost of care. Then also, helping people determine whether or not, right now we're in open enrollment for Medicare. So if anybody is in need of trying to figure out what's the right program for them, particularly if they're managing ongoing disease, now's a great opportunity to leverage those resources to kind of help figure out, what you're on and what it's going to look like. They're able to sort through those pieces and identify what programs are in your area. And then also a little bit more in this piece is if somebody's having trouble with their insurance or their insurance has changed, our case managers can take a look at their insurance plan and really help to understand what the benefits are and what they're covered. Has anybody ever been to the doctor and found out and it said, oh, well, they don't cover that. They cover this, but they don't cover that. And so it's really, some of it's a little bit of a game. And so, the great thing is our team can handle appeals and work directly with, they take that burden off of somebody so that they can focus their efforts on other things. And if for somebody's not working, is COBRA the right decision, short-term disability? So really being able to manage that alphabet soup of healthcare. And so the other thing the second piece that I talked about was really providing emotional health and support. And so you guys truly are exemplary in providing, finding a resource where you can share and come up with emotional support here at this US2 support group. And so there are other resources out there, particularly in the broader space for men who aren't able to go to a support group or may not be one for them specifically. So our navigators can help them find programs. Some people support groups not right for them. They really need a little bit more intensive support. And so helping them, find where's a place where they can connect with an oncology social worker. What's the best way to find that and leverage that? And then also, other educational resources. How do people just a lot of times, of all the surveys we've done, and I'm a big fan of surveys, I'll admit it, but all the surveys that we've done, the first most important need is always people want information. And so we want to make sure that people can get that. And our navigators have their hands on some of the information that Patient Advocate Foundation puts together, which is really specifically sort of general navigation piece, but then also they have access to all of the Zero materials for men. And then they're able to provide and connect resources for some of the other aspects that folks are dealing with. And they also have some great resources for caregivers and want to make sure that, caregivers and loved ones aren't lost in the process. And then we call this provision of support with medical decision-making and treatment options. But really, again, it's taking a look at, for men who need to go one step further with their insurance, is there coverage for a trial? And if you're at that point and you and your doctor have talked about, here's an appropriate trial, they can take a look at your insurance policy and the trial and really help to assess what's that trial going to cover. The insurance will cover this, the trial will cover this, and this part's out of pocket. So those sorts of a little bit more complicated. And then they, what's great about on our end is that they really, utilize evidence-based strategies and techniques and medical professionals to help have these conversations and do this research and really work in partnership with their patients. So that's really key for us. And so what are the benefits? Obviously, our goal is really to save lives and help remove all of those barriers we talked about at the beginning, and probably a lot of barriers that I didn't even touch on that are unique to every single one. But at the end of the day, too, making a man feel like they're involved in their treatment decision making. People who are more engaged in their healthcare are more satisfied, and if you're more satisfied, you're going to be probably more willing to communicate with your healthcare team and have those open discussions. And all these other reasons as well. But really, ultimately, it's to save lives in prostate cancer, but be there as a support resource for men who are dealing with the disease. And if you want to know about the disease, we have a flyer up here, which I guess sorry, thanks, Shawn. I didn't pass out, but there's information on our website. And so what's great about the program is to be able, if you want to enroll in the program or you want to find out more information, we have a toll-free number. So if you don't use the internet or you're not comfortable online, don't want to put your personal information on it, or you just want to use the phone, by all means, you can use the toll-free number and give them a ring, or you can check on the online and just ask them personal information, not a whole lot of it, and then somebody takes a look at it at Patient Advocate Foundation, and you get matched up with a case manager who has some expertise in really what's going on. And that's really, those are the key points on the Patient Navigator program. Are there any questions?
Some of these names cover transportation. How does that take form? What do you do with that?
So let's say somebody is having trouble, they have a far distance to go and it's pricing, it's costly. So they would give a ring, find us with us, and that would be identified as really their primary need. And so our navigator would really look around in this community and the national resources to see what's available, and then be able to match them up with it. Are there services that are provided for free? Is there a gas card program? Is there anything that they can apply for? For men who are living with advanced prostate cancer, there is a transportation fund that is open and available. So they know to be able to go that. And what's great is, yes, I know all of that, but now we have 30 or 40 people down in Newport News who know all of that. And so it's just really, suddenly we've grown from being 1 to 2 to having this huge network. And so something, that seems like it shouldn't be, but travel can be complicated and pricey. So that's a perfect example.
I guess
Yes.
the question is more for David. Knowing what you know about this, how is that different than the Navigator program that Innova provides?
Not that different, except that it's more on a national level. I mean, which should be mining the same kind of resources, and I think we may, at least at this point, we probably have more of a knowledge of local resources, because we've been in this area for longer. Ours are maybe going to be a little bit, well, as you know, our organization is doing navigation as well as sort of the psychosocial support education and across multiple diagnoses. So not just prostate cancer, but all cancers. Does that answer your question?
Well, for example, you assist in the area of insurance and financial support as these folks do. Is that something you do, or is that an area where there's no overlap?
No, that is an area of overlap. In part, we overlap the same way that these guys do in terms of being able to call up people like this Patient Advocate Foundation or some other kinds of advocacy sort of organizations, the Cancer Legal Resource Center, those kinds of places. But we also can directly advocate for patients, and so we can do it that way as well. Our navigators, so we have, in our organization, we have counselors, therapists, and then navigators. And the navigators are oncology nurse navigators, and so they sort of serve two roles. One would be doing sort of teaching education around disease and side effects and management of that, and the second would be looking at barriers or obstacles to treatment and getting the news met that way and working to overcome those kinds of barriers. And to that end, they might be a little bit more integrated in some of the, or at least in the ANOVA health system, and in some of the other health systems too, in terms of being able to make referrals. Maybe not, I don't know, I'm just learning about this program right now too.
Well, and what I know from hospital-based patient navigation programs, it's true. Our navigators are, they're not going to provide psychosocial support, or they're not going to provide counseling. They'll match somebody up. But David can sort of turn around and either do it yourself, or you have a colleague that can do it. So it's a very different touch model. And so what you have in a hospital, particularly if you have oncology nurses and oncology social workers, you have a very, very, very close touch and relationship with your patients, I would think. And for us, it's a little bit one step further, primarily because it's national. But as opposed to being able to provide those counseling services, we are able to match people up with them or find the appropriate ones in their community.
How do you deal with a situation advanced cancer patient is believing he can survive and be have a good remission with additional treatment, and his physician, his oncologist, has recommended hospice care. Is that will sort of nobody intervenes, that will resolve itself over a few months. But if there is an opportunity, are navigators in a position to have resources that make a second assessment of this situation, or the fact that the doctor Kaiser may be spot on with the recommendation. There's no reasonable doctor that would put additional medical expenses toward this guy's treatment. So how do you resolve those kinds of issues, or is that not an issue that you could resolve?
No, that's an excellent question and a great example. And it sounds like it would be tough, but we don't provide any medical advice. We don't steer people to treatment facilities or tell them. We provide them with the information and help them. So if somebody calls up and they're distressed and they've been given this advice, but they think that there may be other treatment options, there may be other ways to go. So we'd provide them with that information, other treatment options that would be available, help take a look at their insurance and see what would cover if they're interested in a second opinion, where would their insurance allow them to go. And provide the patient most likely with as much information about the entire continuum that they've talked about, so that they're armed with that information to be able to go. Does that answer your question adequately?
Not really able to help in this situation.
Not in the sense of providing medical advice.
We're not going to provide medical advice.
They wouldn't listen to what's going on and then give you their opinion or a second opinion or anything along those lines. So from a medical advice standpoint, it would
A
not.
second opinion.
But we would help to facilitate that second opinion. Help to say, what's your coverage? These are the places that you can go that you're covered. And so, but that's not we are not physicians and don't know your clinical care.
Just wondering, if that's the sort of thing that you can involve.
I get questions and calls like that on a regular basis. And it really comes down to being able to help somebody, advocate for themselves and work the system to their benefit. Are there any other questions? Thank you so much. And please, by all means, and if you have questions about the program, you're welcome to contact me.
Well, perfect. Well, thank you, everyone. Thank you to Shawn and Ivy. Give them a round of applause. Hopefully.
I do have one more flyer here. Dr. Gandhi requested this special for you guys. It lists all of our programs in one place for you. So, and then my contact information is up there at the top if you guys want to get in touch. You have that one, all right, great. Yeah, you got it.
I know it's a lot of material, but it's, the whole goal is to know all the things and resources that are available, and that's kind of the purpose of the different meetings and different things, is to kind of bridge that gap that, these programs that they're discussing may not be applicable to 80% of the men in here, but it may, strike a chord in that one guy that it can make a big difference. And so that's why we really want to do this. So thank you again, Shawn and Ivy, for coming, sharing this. We really appreciate it.